So relating to CHF, we're going to go over the CHF Pathway order set. We're going to discuss how to involve social work and nutrition care. We're going to go over how to document heart failure education, daily weights and intake and output. And finally, we're going to discuss how to educate our patients and their families on CHF. Because we're covering so many topics, please note that this in-service will be divided into multiple videos. Please make sure to sign each attendance sheet for each video to get credit. Now, the CHF pathway is for our patients with congestive heart failure. The pathway is going to be initiated by a provider as an order set, and the purpose is essentially to streamline care, making sure that our CHF patients are receiving all necessary orders and interventions. Let's go over some important orders in this order set. So the first thing is the vital signs. They're going to be done every 4 hours, and there are going to be specific ranges that the doctor wants to be aware of and notify them for. So if you have a pulse less than 50 or greater than 120, a respiratory rate less than 12 or greater than 25, a temp greater than 38.1 Celsius, a systolic blood pressure less than 90 or greater than 160, a diastolic BP less than 50 or greater than 90, and urinary output less than 30 mL per hour or 250 mL for 8 hours if O2 sat is less than 90%. So this will always be here for you to reference, just be aware that it's there. And for the last thing, please make sure that your heart failure patients are on a heart healthy diet. It has to be low sodium and low fat. So for our CHF patients, it's important to weigh them every day. We're going to weigh them after they void and before they eat breakfast. Regarding strict intake and output, make sure to document every 8 hours at least. And regarding fluid restriction, the normal fluid restriction will be around 1,500 mL per day, so please make sure to follow that strictly. Now there are labs and tests that you should anticipate for your CHF patient. One of those tests is an EKG, so please do those as ordered. Another test that you should anticipate is an echo, more specifically a TTE, a transthoracic echocardiogram. Now this type of echo is non-invasive, and what it does is it uses ultrasound to create a moving picture of your heart. Now, what's the purpose of this echo? The purpose is to measure the ejection fraction, which is the EF. And the ejection fraction is basically a measurement of how much blood the left ventricle pumps out with each contraction. And this measurement is expressed in a percentage. So for example, we have a patient that has an EF of 60%. What does that mean? That means that 60% of the total amount of blood in the left ventricle is pushed out with each heartbeat. Now, a normal EF is going to be 55%, and a patient with heart failure will have an EF of 40% or less. Now, a lab you should anticipate for your CHF patient is a BNP. A BNP will be elevated if heart failure is present. It's going to be collected on admission and prior to discharge, and the normal levels are 0 to 100 picograms per milliliter. Please make sure to consult social work and nutrition for your CHF patients. We'll go into more detail with that later on. Now, for your CHF patient, you should anticipate certain medications. One of those medications is Lasix, a diuretic. Another medication you should anticipate is Entresto. Now, Entresto is a combo drug. It's made up of valsartan and sacubitril. It's used to treat heart failure, and it does that by relaxing the blood vessels, which improves blood flow, which in turn reduces the stress on the heart. And by doing this, it lowers the risk of cardiovascular death. Now, there's one very important thing regarding Entresto. Please do not start it until the patient has been off ACE inhibitors for 36 hours. Now, examples of ACE inhibitors are enalapril, captopril, ramipril, and prinavil.